I want to tell you about a conversation I had with a patient. Now, let's call him Mr. Adeyemi. He's a 54-year-old man who came into my clinic for his routine prostate check. Very sharp man, very health conscious. He told me he had been intentionally holding back on sexual activity for the past 2 years because someone in his church told him that ejaculating too frequently drained the prostate and increased the chances of prostate cancer. I paused and I looked at him and I said, Mr. Adeyemi, I need you to hear what I'm about to tell you very carefully because the science says the exact opposite. And that right there is why we are having this conversation today. Now, welcome to my channel. I am Dr. Emmanuel Bale, and today we are going deep into one of the most fascinating topic in men's health. Does how often you ejaculate have any connection to your risk of developing prostate cancer? The answer may genuinely surprise you, and more importantly, the science behind it will change how you think about your sexual health and your prostate for the rest of your life. So let's settle in because this one is important. Now, why prostate cancer deserves your attention right now? Let me start by making sure you understand exactly what we are dealing with when we talk about prostate cancer, because a lot of men brush it off until it is too late. So prostate cancer is one of the most common cancer affecting men worldwide. In fact, statistically, 1 in 8 men will receive a prostate cancer diagnosis at some point during their lifetime. And let that sink in for a moment. If I were sitting in a room with 8 of my male patients right now, the number tells me that at least one of them will face this disease. Now, what makes the prostate cancer both dangerous and manageable is its nature. It is typically a slow growing cancer. That means the decision you make today, the lifestyle choices, the habits, and the things you do or don't do can have a real impact on your risk many years and even decades from now. This is not a disease that sneaks up on you overnight, which means there is a real window of opportunity for prevention. We already know that genetics plays a strong role. If your father or brother had a prostate cancer, your risk is increasingly elevated. We also know that diet, weight, and physical activity and other lifestyle factors matters enormously. But here is where it gets really interesting because the prostate is fundamentally a reproductive organ. Its primary job is to produce fluid that forms part of the ejaculate, the fluid that nourish and protect the sperm. And that raises a very logical question that researchers have been asking for decades. Could sexual behavior, specifically how often a man ejaculates, influence his risk of developing prostate cancer? Let's look at what the science actually says. The most significant piece of research on this subject comes from one of the most respected institutions in the world, Harvard University, through what is known as the Health Professional Follow-up Studies. Now, here is how it works. Since 1986, this study has been tracking a large group of male health professionals. We are talking about dentists, pharmacists, veterinarians, optometrists, and others. And in 1992, over 29,000 men between the ages of 46 and 81 provided detailed information about their average numbers of ejaculation per month across 3 key life stages: the young adulthood, which is the age between 20 and 29, the middle age between 40 and 49, and the most recent year. Ejaculation included intercourse, masturbation, and nocturnal emissions. Every 2 years, these men also submitted comprehensive health and lifestyle data. So, what do they find? Here is the headline. Men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to men who ejaculated just 4 to 7 times per month. That is not a marginal finding, that is a substantial, statistically significant result. 21 times a month. That's roughly about 5 times per week. Now, I'm not standing here prescribing that as a clinical regimen, but the data is telling us something meaningful about the biology at play. You see, the Australian study confirmed the pattern. Now, one study is interesting. Two independent studies pointing in the same direction That is where I start paying serious attention as a clinician. Researchers in Australia conducted their own investigations involving 2,338 men, and this time focusing on prostate cancer diagnosed before the age of 70. Like the Harvard team, the Australian researchers look at the total ejaculation across different life stages rather than just sexual intercourse alone. The results were remarkably consistent. Men who averaged between 4.6 to 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70, compared to men who ejaculated fewer than 2.3 times per week. But here's what struck me most about the Australia findings, and this is something I explain carefully to my patient when this topic comes up in my consultation. The protective effect was strongest for ejaculation frequency in young adulthood, not middle age, not in the 50s. We're talking about sexual activity in a man's 20s having measurable impact on prostate cancer risk decades later. This tells me something important about the prostate biology during the developmental years. The prostate in the early adulthood is still maturing, and what happens during that window appears to set a kind of biological tone that can echo forward across a man's entire life. Here is the science behind why this happens. I know some of you are thinking, Dr. Bale, that sounds great, but why would ejaculation frequency actually matter biologically? That's a fair question, but let me explain the leading theory in plain language. Theory number one, the prostate stagnation hypothesis. This is the dominant theory and it makes intuitive sense. The prostate continually produces and accumulates secretive fluids. If that fluid is not regularly expelled, it can stagnate, and over time, stagnant fluid may harbor carcinogenics, that is, cancer promoting substances. You see, regular ejaculation essentially flushes the prostate, reducing the time those potentially harmful substances spend in contact with the prostate tissues. Think of it like this: if you leave a water sitting in a pipe for months without circulation, it can develop problems. And the same principle apply here. Now, theory number two is a psychological stress reduction. There is solid evidence linking chronic psychological stress to an increased risk of several cancer. You see, regular sexual activity has well-documented effect on stress hormone regulations, particularly cortisol. Men with more frequent ejaculation may simply carry lower baseline stress, and that systemic effect could contribute to lower cancer risk. Then number three, prostate microbiomes and cellular metabolism. This is a newer area of research, but a fascinating one. Regular ejaculation appears to support a healthy prostate microbiomes, which is the community of microorganisms that inhabit the glands. Additionally, it may support normal cellular metabolism of zinc and citrates. These two compounds are critical to prostate cell health and function. So, disruption in zinc and citrate metabolism have been linked to malignant changes in the prostate tissue. These three theories together paints a compelling biological picture that is not a random correlation. There are plausible evidence-based mechanisms at work. And before I go on, if you are finding this conversation valuable and if you feel like you are learning things your doctors have has never taken time to explain to you in this kind of details, please do me a favor and hit that subscribe button and turn on your notification. Every week, I bring you evidence based men's health content delivered in the same way I would explain it to a patient sitting in my clinic. No fluff, no fear mongering, just real medicine. Now, let's keep going. A 2021 analysis published in the journal European Urology examined data from the multiple cohort studies and introduced a important nuisance to this conversation. The relationship between the ejaculation frequency and prostate cancer risks may be partially mediated by inflammation. Specifically, researchers found that frequent ejaculation was associated with reduced levels of pro-inflammatory cytokines in prostate tissues. These are chemical signals that, when chronically elevated, can create an environment favorable to cancer cell development. What does this mean in practical terms? It suggests that The benefit of frequent ejaculation may not just be mechanical, not just about flushing the glands, but also about actively reducing chronic low-grade inflammation in the prostate. And chronic inflammation, as we now know, is a foundational driver of cancer across many organ systems. And this adds another powerful layer to the argument. We are not just talking about fluid management, we are talking about immunological and inflammatory regulations at the tissue levels. That is a clinical finding and it moves us closer to truly understanding the mechanism, not just observing the correlation. So, what I tell my patients and what you should know is this. So, the data from the Harvard, from the Australia, and from the more recent research is consistent and compelling. But I want to be clear about what it means and what it does not mean. It does not mean that I am going to write you prescriptions that says ejaculate 21 times this month. No, medicine doesn't work that way. And responsible interpretation of science doesn't work that way either. These large observational studies, they show strong associations, but associations is not the same thing as absolute proof of causation. What I do tell my patients in this is this: if you have been holding back out of fear that sexual activity is somehow harmful to your prostate, that myth has no scientific basis. In fact, the evidence points in the opposite direction. Regular ejaculation as part of a healthy lifestyle appears to be genuinely protective against low grade prostate cancer. I emphasize low grade because it is worth noting that the most consistent benefit in these studies was seen for lower risk prostate cancer. The data on aggressive high grade or metastatic prostate cancer is less clear. And so this is not a cure all, but it does not replace your PSA screening, your regular checkups, or a healthy diet. Now, here is a bigger picture. It starts in your 20s. One of the most profound takeaway from these studies is the emphasis on early adulthood. Both the Harvard and the Australia research consistently showed that ejaculation frequency in a man's 20s had the greatest long-term impact on prostate cancer risk. This mirrors what we see with other diseases. Childhood sunburn increases the risk of skin cancer decades later. Early dietary pattern influence cardiovascular disease risk in midlife. Prenatal and early developmental factors shape lifetime risks for hypertension. The prostate is no different. So, what happens during its developmental years creates a biological legacy. This is what I am passionate about talking to younger men about prostate health. We tend to think of prostate cancer as an older man's disease, but the seed of risk may be planted much earlier than we have traditionally appreciated. Young men need to understand that their habits today, their stress level, their sexual health, and their diet and physical activity are writing a script for their prostate health in their 50s and in their 60s. So let me bring it all home for you. The science is clear. Regular ejaculation is associated with meaningful reduced risk of prostate cancer. Two major independent studies involving one nearly 30,000 men and another involving over 2,000 agreed on this. The biological mechanisms are plausible. They are increasingly well understood and supported by emerging inflammatory research. And the window of greatest impact appear to be early adulthood. Does this mean you should be reckless or obsessive about sexual frequency? Of course not. But it absolutely means you should stop feeling guilty. You should stop feeling ashamed or afraid of a natural, healthy physiological function. And it means you should be having a regular conversation with your doctor about your prostate health, starting now and not when the problem arises. So if you're a man over 40 washing days, please ensure you are getting your PSA level checked regularly and discussing your individual risk profile with your physician. If you have a family history of prostate cancer, that conversation should start even earlier. And if you found today's videos informative, if it answered questions you didn't even know you had, please share it with other men in your life. Your brother, share with your brother, your father, friend, a colleague, men do not talk about prostate health nearly enough, and that silent costs lives. I am Dr. Emmanuel Bale. Thanks for spending this wonderful time with me today. And remember, your health is not a luxury, it is your greatest asset. So take care of it, stay informed, and stay proactive. And I will see you in the next video. Thank you.